the honourable member for Winnipeg South Centre.
Thank you very much, Mr. Speaker. Always an honor to rise in this House. I just wanted to start on a personal level. I always was so proud to grow up with my mother as a family physician. She continues to practice medicine in Winnipeg. She has now, in the past number of years, moved into working with people battling addictions. But much of my understanding of the healthcare system and how we care for people in our society has come through the compassion and the expertise and professionalism that I have seen on my mother's part. So it's with her in my mind that I rise today to speak about Pharmacare. Mr. Speaker, like so many of our colleagues in the House, I have heard from constituents who are eager for the government to move in a direction that will allow for universal Pharmacare plan. And there are a variety of reasons for this, which I'll get to later in my remarks. But I have heard primarily from seniors who, whether it's the government's plans on dental care, whether it is this proposed piece of legislation that we're talking about today, whether it's investments in aging in place with dignity, they are extremely enthusiastic about the direction that the government is headed in relation to a variety of different healthcare policies. Mr. Speaker, as you know, recently there was an election in my home province of Manitoba, and we have been working collaboratively with the new government and was very proud to have joined other colleagues as well as the Premier and the Manitoba Health Minister not too long ago to announce a $630 million healthcare deal with the province of Manitoba that is going to see us invest directly in a variety of different areas that are going to make a difference in the lives of my constituents, Winnipeggers and Manitobans, broadly speaking. And those include things like reductions of wait times, investments in mental health and addiction, and ensuring that we have greater efficiency in our healthcare system. And Mr. Speaker, of course, I've talked often in this chamber about my experience as a teacher and as a principal and as a coach, having worked for many years with young people. And I'm proud of the investments that we're making in youth mental health. But I also note that many of the students I worked with in the northwest part of the city of Winnipeg, unfortunately, and in many instances disproportionately, were impacted by type 2 diabetes. And we saw that that was Indigenous communities in particular that were facing those challenges. So I come to this with some firsthand experience, having seen how difficult it can be to operate without coverage. Mr. Speaker, the government is committed to implementing a national universal pharmacare so that all Canadians have access to the prescription drugs that they need. Monsieur le Président, notre gouvernement s'est engagé à mettre en place un régime national universel d'assurance médicaments afin que tous les Canadiens aient accès aux médicaments sur ordonnance dont ils ont besoin. Our government, Mr. Speaker, has been working on a solid foundation on which to build national universal pharmacare. This work includes investments in the National Strategy for Drugs for Rare Diseases to help Canadians with rare diseases access the drugs that they need, as well as the announcement in December 2023 on the creation of a Canadian Drug Agency. Monsieur le Président, notre gouvernement a travaillé à l'élaboration d'une base solide sur laquelle bâtir un régime national universel d'assurance médicaments. Ce travail comprend des investissements dans la stratégie nationale sur les médicaments pour le traitement des maladies rares pour aider les Canadiens atteints de maladies rares à accéder aux médicaments dont ils ont besoin et l'annonce de la création d'une agence canadienne des médicaments en décembre 2023. With the help of the Canadian Agency for Drugs and Technology and Health, Mr. Speaker, we have also completed preliminary work toward a national formulary. This work included the establishment of a multidisciplinary advisory panel with a recommended framework and process for the development of a national formulary. Avec l'aide de l'Agence canadienne des médicaments et des technologies de la santé, nous avons également achevé les travaux préliminaires en vue de l'établissement d'une liste nationale des médicaments assurés. Ce travail comprenait la mise en place d'un groupe consultatif multidisciplinaire qui nationale d'assurance médicaments peuvent continuer de travailler ensemble. In Canada, the roles and responsibilities for healthcare services are shared between provincial and territorial governments and the federal government, as we know, Mr. Speaker. Au Canada, les rôles et les responsabilités des services de soins de santé sont partagés entre les gouvernements provinciaux et territoriaux et le gouvernement fédéral. The provincial and territorial governments, Mr. Speaker, are responsible for the management, organization, and delivery of healthcare services for their residents, which includes determining which drugs are reimbursed and under what conditions for their eligible populations. Mr. Speaker, we look forward to continuing to collaborate with our provincial and territorial partners to improve the accessibility to and affordability of prescription drugs for Canadians. This bill will do just that, Mr. Speaker, starting with contraception and diabetes products. Nous nous réjouissons de continuer à collaborer avec nos partenaires provinciaux et territoriaux afin de rendre les médicaments sur ordonnance plus accessibles et plus abordables pour les Canadiens. Et c'est que fera ce projet de loi, en commençant par les produits contraceptifs et les produits pour le traitement du diabète. By continuing our work together and making wise investments, we can ensure that the healthcare system is there for us when we need it, both now and in years to come. En poursuivant notre travail ensemble et en faisant des investissements judicieux, nous pouvons faire en sorte que le système de soins de santé soit là pour nous quand nous avons besoin aujourd'hui et dans les années à venir. Mr. Speaker, I said at the outset of my remarks that I spent a number of years as an educator. And it was during that time that you get to know kids and their families on very personal levels. You don't just get to understand them as students, but you get to understand them as people and all of the challenges that come along with daily life. And Mr. Speaker, some of those challenges included access to health care. I can't tell you how many times, for example, I would have a single First Nations mother with a child in crisis in my office. And she wasn't sure how to advocate well for her child because they had had so many challenges over the years interacting with the healthcare system. I remember, Mr. Speaker, one particular instance where a child was having some significant mental health issues. And I said, I think we really need to call your son's doctor and get an appointment for him. And she picked up the phone and called the doctor. And the receptionist at the office answered the phone and said, well, unfortunately, we don't have a spot for the next 4 months. This was a young person who was contemplating taking their own life at the time, Mr. Speaker. So I was fortunate enough, by virtue of something I mentioned at the beginning of my remarks, and that is having seen my mother's ability to operate and navigate the system, to be able to help that family in that particular instance. But this is not uncommon, Mr. Speaker, particularly for marginalized communities, and in Manitoba, more specifically, that is Indigenous communities, whether that be First Nations, Métis, or Inuit, and newcomers who have difficulty accessing our healthcare system for a variety of different reasons. In addition to that, many of these families, many of these single mothers or single fathers were working multiple jobs. They had to go long ways across the city in order to make ends meet and in order to provide for their families. And they didn't have access to plans. They didn't have access to medications that would allow them to live healthier and more prosperous lives. So, Mr. Speaker, I have those families, those kids in my mind when I think about what this bill will mean for them and their future. And I am proud, Mr. Speaker, to have the opportunity to rise today to talk about what we can accomplish through this historic piece of legislation. And with that, Mr. Speaker, I know that my time is running short, so I will gladly take my seat for a moment and welcome questions from my colleagues across the way. Thank you very much.